Welcome to another great installment of Black History Month, Woodsoul Black History Month. If you don't know who I am Larry Alade, co-chair of the Woodsoul Black History Month Planning Committee. And it's an absolute pleasure to have you guys here. I really appreciate you spending time with us. We have another great program for you. And I would like to take a moment to thank our Woodsoul Black History Month Planning Committee, because without them, we couldn't have pulled these programs together. I also want to thank the 6 institutions for supporting our program annually. And that includes the Marine Biological Laboratory, the Northeast Fisheries Science Center, the Woodwell Climate Research Center, United States Geological Survey, Sea Education Association. Wanted to also take a few minutes too, as we are celebrating Black History Month, but to also recognize that, we have some growing tension in the world, that we are thinking of our people at the border, on the eastern borders of Ukraine. I mean, we've heard news that there's been rising tension that's going on. So we want to recognize that there's a lot going on there, that our prayers and thoughts are with them. And so I wanted to take a brief minute just to highlight that and acknowledge them. And we're sending our positive thoughts to them. But before we jump right in, I wanted to take a brief moment to invite the chair of the Diversity Advisory Committee, Hauke, to give us brief remarks on behalf of the Woodsoul Diversity Initiative, and then we'll take it from there and we'll be jumping into the program. So with that said, Hauke, welcome.
Thank you very much, Larry. Good evening and welcome, everyone. Thank you for that introduction, Larry. I appreciate everything you said. I want to also welcome all of you on behalf of the Woodsoul Diversity Initiative and the 6 member institutions that Larry spoke of. And I want to thank Larry and Anji, the co-chairs of this year's Black History Month organizing group, and all the others who helped pull this year's excellent program together. Black History Month has been celebrated in Woodsoul for much longer than the Diversity Initiative has been around. And so it's an honor to do our part to keep that tradition going. With that, I want to again just welcome all of you this evening and thank Misty very much for joining us tonight and speaking with us. I look forward to the presentation, and I will turn it back over to Larry.
Thank you very much, Hauke. So before we fully really dive in today, I thought that, I'll take a brief moment to really talk about, the Black History Month Committee and also highlight the theme for this year. So every year, members of the Woodsoul community, we come together, we celebrate Black History Month, and the goal is to build a stronger community through diversity. Our committee serves 6 scientific research institutions that I mentioned earlier. And, we've been, since the 1870s, been the hub and center of scientific discovery, marine sciences, and many more areas of STEM. But our purpose as a committee is to work towards an inclusive and welcoming environment for all. We host events, lectures, talks around diversity and inclusion, which is at the heart of our governance. And so this year, Black History Month theme, we are focusing on the importance of Black health and wellness. The theme highlights not only the legacy of Black scholars and medical practitioners in Western medicine, but also considers other forms of non-traditional forms of wellness that Black communities have done very well. The theme also highlights some of the historical and contemporary disparities in healthcare across healthcare access in the marginalized communities. And if you think about it, in the 21st century that we are in right now, our understanding of Black health and wellness is much broader and more nuanced than ever. The growing normalization of mental health as a form of wellness continues to increase the effort to destigmatize mental illness. We see Black girls doing the breath work, and there are whole yoga studios dedicated to people of color. But we do recognize that more work still needs to be done with regards to equity and access. And so with that said, I'd like to introduce you to our guest speaker tonight, Dr. Misty Boachie. Dr. Boachie is a proven pharmacy leader and holistic wellness advocate with clinical and management expertise across a range of healthcare settings, including acute care, outpatient infusion, oncology, and nutritional support. Dr. Boachie is a pharmacotherapy board certified pharmacist, currently serving in a leadership position at the Northside Hospital in Atlanta, Georgia. She holds a Doctor of Pharmacy from the University of Georgia, Masters of Business Administration from George Washington University, and she completed a pharmacy practice residency at the Columbus Regional Healthcare System. She is the CEO and founder of Excavate Wellness, and the mission is to encourage, educate, and enable people through provision of nutritional, emotional, spiritual, and physical support. She resides in Atlanta, Georgia with her husband, Kofi, and sons, August and Alistair. Without further ado, please help me welcome Dr. Misty Boachie.
Hello, thank you everyone. Thank you so much for that kind and generous introduction. I'm just so honored to be in community with you tonight and so grateful for this opportunity to share. So tonight I will be discussing some topics that may be triggering to some. I want to make sure that we have a trauma-informed presentation and that I explain what's coming next and what follows. My intent in sharing so earnestly about challenging topics is to give voice to survivors and to create a safe, non-judgmental community for folks to openly grapple with their pain. So I support you in taking care of yourself in any way that you need to. If you need to log off, step back, stop sharing your screen, mute me, whatever you need to do to take care of yourself tonight, I support that. And I will say that this discussion is not a substitute for mental health counseling or psychiatric services. I'm a pharmacist by training, as you've heard, and I'm not a physician or a psychologist. So tonight's talk is just that, a talk. So it's just open sharing and hopefully a safe space for all those who take part this evening. So if you were paying attention to the lead in, you know that this is not your typical wellness talk. I just want to make sure, can everybody hear me and see me now?
You're good, Misty.
Okay, great. So yeah, we're not going to be counting calories tonight. There'll be no mention of diet plans or fitness trackers. I'm not going to advise you on how to get snatched. And I'm not going to convince you to get a Brazilian butt lift or to not get one. That is not my business. But let's start out with a few prerequisites though. I need to make sure we're kind of on the same page and have the same baseline appreciation for some of these health and wellness concepts. So I think we're going to have some polling questions come up. Don't worry, you're going to be great. I just know you're going to do well. So the first question is this: what is the more nutritious option, an apple or a bag of chips? And I think there's a way that you should be able to see how to vote or cast your answer. And then it'll be tallied. Okay, you guys are smart. You know what? I'm going to let you do the talk. You got 100. So yeah, certainly the apple is going to have more lasting nutrition, energy, fiber is going to be in the core of that apple and so much else. So yes. Okay, so now how about this one? What provides more cardiovascular benefit? Going on a long, brisk walk or sitting on the couch, flipping channels? So there you go. You can your answer. Yeah, I'm gonna have to concede my seat and let you guys carry on from here. You got a 100. Okay, last question. And we're gonna take it up a notch with pharmacology here. So in the context of diabetes, is it more appropriate, i.e. life-sustaining, to take your insulin as prescribed or just skip it? Just opt out of the insulin, A or B? Oh, perfect score. Perfect score. I'm so impressed. So, but wait, I'm impressed, but now I'm seriously puzzled, because if we know so much about health and wellness, then why are people getting sicker and sicker? During the 20 years I've been a pharmacist, why are the med lists getting longer? The list of comorbidities lengthening? What is going on? If we're so well informed, if you can just walk into a presentation and make a 100 on nutrition, fitness, pharmacology, what's the problem? And I'm really asking you, I'm over here now like Marvin Gaye, what's really going on? So our fourth and final question, what is contributing to it? What's fueling this rampant state of dis-ease across cultures and zip codes, across education levels and income? What is it? Income inequality, food deserts, access disparities in healthcare, the opiate crisis, the food industry, or all the above? Oh, you nailed it. Wow, all of the above. And we know that this healthcare picture is complex. I mean, it's a conundrum, to say the least. And much of what ails us is systemic. So we're talking about baked in, hardened, structural hardship that's failing a wide swath of our society. And make no mistake, these obstacles are designed to work just as they are against the poor, against Black and brown communities, against minorities, against marginalized and oppressed and otherwise disenfranchised groups. This is our reality. This is it. So given the present state of affairs, what I'd like to do tonight is step through some of these stumbling blocks. And I want to reassure you that we're empowered to overcome each of these three things that we're going to talk about tonight: trauma, addiction, and mental illness. And we will be going in that order. So I'm convinced that these elements, whether taken individually or together, must be incorporated into our current healthcare model if we are to sustainably and effectively address all of these disease states that are running rampant among us. So we'll start with trauma. And I'll say this, until the past few years, I didn't really think trauma was meant for most of us. I thought trauma applied mainly to war veterans, people who had lived through natural disasters such as Katrina. Anything other than those two domains, I just attributed it to, life is hard out here in these streets. Or my typical fallback is child is rough. And we would just go on from there. But fortunately, I have evolved in my thinking, and I've come to more fully understand and appreciate the ways that trauma affects us during childhood and also beyond that throughout our lives. And if trauma sounds inaccessible to you, or if it sounds like hyperbole, I would invite you to fall back to my working definition, which is terrible experiences, acute or chronic, that negatively impact us, either consciously or unconsciously throughout life. And I certainly understand the reluctance that many of us have to place ourselves and our personal struggles in the realm of trauma. It kind of goes like this. Sure, I've had problems in my life. Everybody has, but trauma, no, that's not me. And we can't really have a real discussion about trauma without also talking about adversity. Society, I find, has a tendency to valorize difficult upbringings and surviving challenging environments. And it often leads to a certain type of denial, I would say, or perverse kind of pride, which is understandable, make no mistake, to be proud of that survival. But I think that praise is certainly warranted, but I would posit that we can still kind of rep our hoods and hold space for how it may have felt to be unsafe, to have been neglected, or to have been harmed. And I really love this description that comes from Robin DiAngelo, the author of White Fragility. And this is what she has to say about it. I have never understood people who say we were poor, but we didn't know because we had so much love. The pain and humiliation of poverty are visceral. Poverty isn't romantic or some form of simple living. The lack of medical and dental care, the hunger, and the ostracization are concrete. The stress of poverty made my household much more chaotic than loving. And this little sample comes from her current book, Nice Racism: How Progressive White People Perpetuate Racial Harm. And I thought, what she described is kind of what I'm going for. Yes, we've been through things, and let's not deny it. Let's not brush it away. And if you're anything like me, you likely thought that if you survived the situation, or if you don't live in that house or that neighborhood anymore, then you're free. Congratulations, you made it. But did you? Tyler Perry and Oprah are powerful examples of just how incorrect these assumptions are. Both are talented, wildly successful cultural icons and philanthropists who have both been candid and forthright about abuses that they suffered, poverty and discrimination that they faced, and the lingering effects remain with them. despite their lavish surroundings and numerous accolades. Not only do these troubling and jarring experiences affect our emotional states and decision-making, we have learned how they negatively affect our health. Is anyone familiar with an ACE score? And I don't know that I can see the comments. I don't know that I can see anyone's hands being raised, but does anybody know what an ACE score is, or does anybody want to share or just raise their hand with familiarity there? And I'll share my screen. Okay, so ACE stands for Adverse Childhood Experiences. Examples include abuse, neglect, parental addiction, mental illness, divorce. According to the Adverse Childhood Experiences study, the rougher your childhood, the higher your score is likely to be, and the higher your risk for later health problems. Researchers have found higher incidences of various behaviors, such as lack of physical activity, smoking, and missed work, and also physical and mental health challenges, cancer, heart disease, and strokes. We will discuss mental health manifestations a bit later, but as you might well suspect, those of us having undergone traumas experience suicidality, depression, and addictions to substances. What we know for sure, with an ACE score of 4 or more, things start getting serious. The likelihood of chronic pulmonary lung disease increases 390%. Hepatitis, 240%. Depression, 460%. Suicide, 1,220%. And that data comes from 2022 research. And something that we didn't have to go into the lab to prove is the impact of racial discrimination and racial violence and the additive effects of collective and ongoing trauma. It's devastating on multiple fronts for minority communities and other at-risk demographies. To be clear, trauma can and does affect us throughout life. However, due to the vulnerability and lack of agency that children have, as well as the lasting impact of childhood adversity, it warrants considerable examination. And the more grown-up vicissitudes of life can come for us at any time, as you well know. Job loss, bereavement, relationship strife, illness, financial struggles. All of these difficulties can push us to the breaking point and manifest as trauma, depending on the specifics of each scenario. Even as we gather ourselves and carry on, we find that these experiences have tainted us and continue to skew our posture towards health and wellness. In ways that we don't consciously recognize, our coping strategies have become habituations that find us still very much trapped by the initial traumatic experiences and circumstances that we fought so bravely to escape. Lack of trust, expecting to be taken advantage of, waiting for the other shoe to drop, being constantly on guard. These tendencies may have seen us through terrible times and actually saved our lives at some point in the past. But I find that these are also what keep us from reaching out. They prevent us from risking vulnerability lest we appear soft or like an easy target. We don't want to get played, get got. We have a code of silence. This keeps us from raising our hand and admitting that we are struggling and need assistance. Being perpetually hard or wearing a superhero cape all the time, at work, at home, everywhere, exacts a toll that leads to emotional and physical manifestations. Failure to work through and properly process these events leave us too defeated and deflated to fully care for ourselves. And does this sound familiar? We will go to war over our kids and our families, but can't seem to make time for a daily workout or to spend quiet time alone, or even for an annual physical. We may masterfully juggle myriad responsibilities at work, but are we neglecting the person that we are most beholden to, ourselves? Perhaps you believe it's weak to cry. Sadly, many children are taught this, and the lesson sticks. with the way things are, you may fear that if you start crying, you'll never stop. I can relate. And what about anger? Do you think you'll lose control of that rage and never come through it? I found actually the opposite to be true. When we crack into repressed feelings such as grief, sadness, and anger, it's actually a pressure release valve that can get us back into a clearer reality, helping us to become embodied and able to fully access the whole range of emotions. So I'll pause here if there are any points of reflection, if anything has arisen within you that you'd like to comment on. If anybody has any questions or wants to talk more about ACE scores, I'll pause now and allow that.
Thank you, Misty. So just a point for our audience that, you can use the Q&A to field your questions, and we'll pass them on to Misty. So I wanted to kind of bring up a point. You talked about the code of silence, and I thought that resonates pretty well. And I'm thinking, we talk about all the social issues that exist too, but there's also economics, and I think you sort of alluded to that, and that some of the barriers there. How do you begin to break through some of the cultural barriers that are there? And I'm going to be explicit about the idea of seeking help is considered a sign of weakness.
Mm-hmm.
So that is a stigma that is out there. How do you begin to change that narrative that people can begin to maximize those resources that are out there to benefit them from a mental health perspective?
I think the first step is to have that internal conversation with yourself. So much of this is conditioned, so much of it is learned. And so it starts inside internally with how do we flip that switch? And I know that people get really honest when they're hurting, and they get really honest when they're in trouble. And the best thing that I can say is, as a society, continuing to have maybe public service announcements about getting mental health. I mean, I'm very encouraged now by how you hear, I'll say the young generation. I'm Generation X, so I'm dating myself, but I love it in some ways, because I'm a hiring manager, so I don't necessarily want to always hear people talking about work-life balance and time off, but I applaud it because people are taking care of themselves. People recognize that, a generation or two ago, when I was a younger and seeking employment and trying to put my best foot forward, I would never tell a hiring manager that I prefer just to only work certain shifts or a few days a week, or even open up in any meaningful way about my mental health or wanting rest. I think we tried to market ourselves as Autobots and we wanted to try to embody, this, I can be everywhere and be all things for you so I can get a job. So something is changing, and I think the dialogue is opening up. I do think that some of these kind of retrograde beliefs are calcified, but I do think it begins within a person. And sometimes when we seek help, it needs to be private. We don't necessarily need to go out and tell our whole family that, hey, I'm going to start going to these 12-step recovery meetings. If we don't get a sense that they're going to support that, I want everybody to have that, but I know that's an illusion. So I think to a person, if you're desperate and you need help, then I think that's when people start reaching for resources. So for me as a healthcare professional, I certainly make it my mission to talk openly and field those questions from my team members and just let them know it's okay. It's okay. You're not meant to be perfect. There's no job description out here that said you had to be perfect, because there's a lot of anxiety. So I just think it starts with each of us.
Thank you for that. So we got 2 questions in the chat, and the first one, second one that came in, I think it's more in line with what we're talking about. So the question is would a more liberal policy towards health leave policies during COVID be a positive step in your opinion?
Oh, certainly, because, this pandemic, it's raging. I remember initially thinking, oh, I don't know. I didn't even have a timeline on it, but I certainly didn't think we'd be in it 3 years later. And so I do think that employers need to have a stance around supporting their workers and recognizing that enough is enough. When you think about having lost almost 1 million Americans, if you think about that collective grief, I know people who've lost multiple family members, and that trauma that people are carrying around, and you're trying to work and keep it all together, and you can't. People just can't. And so I certainly think that needs to happen. And I'm grateful that I do work for a place that cares for us individually. I know a lot of people don't, don't have supervisors who are understanding, don't have a corporate umbrella that recognizes that people need time to take care of themselves. So that's a huge problem, because not enough workplaces espouse self-care and support team members in self-care.
And there's economic consequences to that too, without, person self-care policies within your own, institutions. So second question is around ACE. Say, do you get the ACE score through Psychologist, or is it a questionnaire?
So I'm sure everybody now is going to turn and Google it, because you can just turn and Google it. What I'll say about an ACE score is it's not a crystal ball. And what it doesn't do is it doesn't account for mitigating factors. So if you're a child growing up in a situation that has some of those stressors that we talked about earlier, the ACE score doesn't take into account a loving grandmother who adores you and supports you and praises you, or an exciting, wonderful, dynamic science teacher who is promoting you and wants to help you with the science fair. So it doesn't take into account mitigating factors. And what it also doesn't take into account is every awful thing that can happen. Because I can tell you my ACE score is a 4, but there are things I underwent during my childhood that aren't even on the slide. So I'll say that those are the disclaimers, and the science, will say that too. So the CDC, I think, has a reference to the ACE scores. And again, it's just so out there that you can, like I said, I'm sure everybody is now Googling it and tallying their ACE score during this presentation.
All right. So one thing that I have a question about the ACE score, just to follow up on that, I'm thinking about the Myers and Briggs, which is more of like a personality test. So I'm thinking about the ACE questionnaire, or really a measure of one's risk. Is that something that evolves over time too? Or is that static, or is it just based on your childhood, experiences that sort of link to what your future health risk will be?
Well, so what we know is obviously if there are no interventions. And so the last part of my talk will be about ways to mitigate and hopefully smooth out and support people who have grown up that way. I have not read the data that necessarily reverses it, but I do feel confident that those things can be short-circuited with the right support and the right help. And the ACE score is super simple. People have probably gone on and completed it in the time that we've been doing this Q&A. The questions are something like, okay, if you were, before you turned 18, did this experience happen? Yes, no. It's not very detailed, and I don't think it's more than 10 questions. And then you just tally it, and so the how many yeses, if you get 5 yeses or 8 yeses or something like that, then there's the interpretation of what that could mean, or, that. So again, it is not a crystal ball. We're not just going to give up if our ACE score is an 8. No, but I think it's a great objective tool, and I think it benefits all of us because it's accessible. And then the question becomes, well, what am I going to do about it?
So there's one question here that asks that in trying to increase diversity, would you recommend a person of color to decline an employment situation if they were the only person of color? And so I'm trying to think about, a situation when one may feel like, they don't feel connected to the culture or the workplace, and perhaps, connecting it to our discussion today, how does that really relate to their mental health or their ability to be able to, cope and be well or be their best person at their job?
I will tell you, I was the only person of African descent in my pharmacy school class. So you're talking about over 800 kids applied and 111 of us got in. And I remember being in that lobby on the first day. And I'll let you in on a secret. Us minorities, we kind of look around for each other. And I kept looking around for somebody who looked like me, and that person never showed up. So what I would always say is jump in, but I will tell you, I think those of us in those super minorities like that, there's a lot that we face. We hear so many comments. We are treated, I would say there are microaggressions. I would say there are macro aggressions that have impacted my mental health. But, you know, as Dr. Alade pointed out, this idea that the economics is going to come in there somehow. I was not the person who was going to turn down an opportunity to live my dream, because, and I wouldn't have known at the time that I was the only Black person, but I found out on day one that I was, and I didn't walk away from that. So I will encourage you to find a way to do both, and to find a way to take care of yourself and to succeed economically. I will tell you a huge thing that nurtured me when I was in Athens in pharmacy school was the fact that I lived on campus, and in my dorms, the world looked a little bit more diverse. And so I might walk into the pharmacy school and not see anybody in my year group that looked like me. But by the time I, left, got my book bag and went back to the dorm, I was, eating lunch in the cafeteria in a much more diverse sea of people. I was having, personal conversations and making friends with people from all walks of life and all backgrounds. And I wouldn't trade that for anything.
Thank you. I think Q&A is empty for now, so we can move on. I'm sure more will be coming in.
Okay. So let us now turn to addiction. And so tonight we've started really pulling back the layers of pain, considering past events that may be playing themselves out in our lives over and over and over again to this day. And we feel that it's bringing us down in some cases. And we've also learned that it makes us quite sick. And some of us have years of pain to sort through. And I mean, honestly, who can tolerate feeling bad all the time, especially when the memories feel too horrific to ponder? And in our epic search for relief, we may unwittingly become ensnared by another unforgiving albatross, addiction. Our brains are hardwired to seek pleasure, and endorphins, feel-good hormones, bring on a sense of calm in some cases, excitement, euphoria, and they can even replicate feelings of being loved. And substances can provide that too, although in a fleeting way and with ever increasing doses. So we have reward centers in the brain that gratify us whenever we take a hit of whatever our thing is. And much of it really comes down to how we cope with stress. What got us through the tough times back then, or smooths out the rough edges now? Sadly, whatever we turn to in moments of crisis or even for routine self-care can make the road to healthy living virtually impassable. Nicotine, food, gambling, gaming, spending, devices, marijuana. I said it. I'll say it again. Marijuana, other illicit drugs, opiates, crack, meth, crank, bath salts. Remember, I'm a pharmacist, so I could go on. I'll stop now. Alcohol and sex. Again, if addiction sounds like too loaded a term, let's fall back on my working definition, which is any behavior or substance that may be subverting my purpose and that may require outside intervention to stop it. The most troubling aspect of addiction to me is the tremendous lack of insight that we have into it and how hard we work not to recognize the damage that it's doing. Think about that. We cling tightly, I think, because somewhere along the way we started thinking that we needed that thing to survive, that we couldn't cope without it. When I started listing various examples of addiction, I'll wager that you didn't immediately call yourself out about anything. Did your mind start clicking through the list of people in your life who need to get help? How quickly we leap to separate ourselves from the afflicted. A cousin who we think drinks too much, or a coworker who spends increasingly more time getting smoked out. The invitation here is to challenge our own behaviors and thinking, because the only person you can save is you. And in truth, you might be sicker than the people you are trying to criticize. So here it is. To the extent that we name our issues and become fully accountable for our behaviors, we can begin to turn our attention to life events in the here and now. The hope is that we can start noticing ourselves turning to destructive behaviors over and over, and maybe to short circuit it and lay down new neuronal pathways and hardwire new responses, rather than papering over our wounds. Often addictive behavior is a trauma response. Stories are legion of people acting out with drugs, alcohol, and sex after being violated, or having some other type of emotional torment take place, or physical torment happen in their lives. Someone can become a so-called big spender to sort of blot out the feelings and the pain from a childhood marred by extreme poverty. And ironically, the very behavior that they're perpetuating in their present life is taking them back and recreating the fear and the shame and the mounting debt or the bankruptcy that plagued and marred their childhood. So this behavior, it doesn't arise usually out of absolute thin air. Though some people can come by addictions quite innocently, usually there's some type of root cause that brings it about. And so I do have an example to kind of illustrate a bit of that. So some of you may have read that last month, the actress and Grammy Award winning comedian Tiffany Haddish was arrested south of Atlanta and charged with a DUI. Some accounts noted that she was slumped over and passed out behind the wheel. And while it is not my place to label her behavior or judge it, and I will not, she has been candid about her mother's mental illness, experiencing physical abuse as a child, shuttling between multiple foster homes, and being separated from her siblings many, many times due to the instability in her home. I specifically remember listening to her talk about her childhood on a podcast, and she talked about the pain of being removed from different foster homes and having all her stuff thrown in a plastic bag. She said, I feel that every child needs to have a suitcase because it always made me feel like garbage when they just would take my things and just throw them in a bag. So here we see a complicated tableau typified by a stunning success story and unfortunately dramatic setbacks. And so for our purposes tonight, how attentive can anyone be to themselves, mind, body, and soul when they're nursing an addiction? And please don't think I'm only talking about stereotypical addicts. I think Ms. Haddish certainly exemplifies the idea of a highly functioning, wildly successful person who is still somewhat struggling and masking an inner turmoil that she's very good at keeping hidden. No, we may not have lost it all, yet we are still hooked in by actions that cause self-neglect and self-harm. The attendant deterioration can be surprisingly rapid or play out over decades. Some of my sickest patients over the years have been addicts, alcoholics with hepatitis and cirrhosis, gastric bypass surgery candidates who unfortunately might have had post-op complications or infections and were brought back to the hospital for us to manage that. Probably the most heartbreaking are the drug seekers who leave the hospital against medical advice. We call it leaving AMA because they are compelled to get high and they're terrified of getting dope sick. So they're not even concerned about whatever acute situation brought them into the hospital. They've got to get out and they've got to go use. So addictions render us incapable of hearing, let alone accepting even the best advice and treatment. So I will pause and allow some of this to kind of settle. And if you have any thoughts that have surfaced, anything you'd like to share, take issue with, ask questions about, I welcome that.
So I think I'll jump in here. what you've provided here is really things that, we overlook and take for granted in society. And, addiction, is real. And yes, clearly understand that it's linked to like, trauma from the past, or like, some really traumatic situation that, one may have gone through, and trying to find a way to like, overcome that.
Mhm.
So there's a couple of things I'm thinking is that, how do people have the courage? What do they have to do to be able to get the help that they need? And how do we create a community in a way that is supportive to allow individuals to sort of like, really transition from the space of it into like, a better well living. And part of that too is being able to do the work and recognizing that we're going to fall through this process doing it. But how do you, change that narrative? And two, how do we create a community structure that's supportive for individuals to, seek the healing that they need?
I can kind of talk about it, from the lens, through the lens of public policy. And I know in this country, largely drug use and addiction has been punitive. And I've seen recently, as you all have too, kind of a transition towards, we can't arrest our way out of the drug problem. And people now, they're saying, are sick. They're more willing societally to acknowledge addiction as a disease, which again I see as progress. But often what we know of, and the truth about our history, is that Black and brown people have been, pretty much at the point of the spear in terms of the punishment related to that. When you look back to the late 70s, early 80s with the crack epidemic, going back to Reagan, vilifying welfare queens and crack babies and drug dealers and all of this stuff. Rudy Giuliani, he made his bones by taking down Nicky Barnes, a notorious drug dealer in New York, on his way to becoming attorney general and some other things, the governor or the mayor of New York City. But the public policy issues still remain. We're still grappling in this country with the opioid crisis, with all the drug issues that we had before. And you see that drugs are a big business. And so for me, the answer is who benefits. And until we're willing to go after the people who benefit from the trafficking, from the importing of drugs, from the synthesizing of drugs and all of that stuff, we're not going to be able to fully address it because there are unlikely suspects in this. Those people probably won't ever go to jail or ever be penalized. And we have this kind of ongoing revolving door of kind of low, street level people going to jail over and over. So part of what my work is about what we can do as individuals. Because I don't know if that train, is going to come and help us, whether it be congressional changes or public policy initiatives. And so what I tout largely in my work is 12-step recovery. But there is a high rate of recidivism, for meth, for opiates. I am a food addict. I'm a compulsive overeater. I can tell you that it is an iterative process, but to have something that is free, something that's affordable, that brings people into community to share openly about what their troubles are, I can tell you miracles happen in 12-step meetings. And we'll talk more in depth about that too. But yeah, I'm definitely all about what can I do on the individual level, on the family level, on the community level.
Thank you for that. So there's a question, you may have addressed this, but maybe you want to revisit this. How do you define addiction?
Well, it was kind of like what I said, and that's just my working definition. I've heard it described as behaviors that are damaging, but that you continue to engage in. That's a way to put it. Some of it, I will say, are socially acceptable addiction. So we can't really necessarily define addiction by legality, because I have to eat something every day, right? An anorexic has to eat, and there's times when they're not eating, what have you. It's okay to play video games, right? So there's certainly a line that you cross when you become someone who is addicted to gaming. And so it can't necessarily be what's illegal or what's socially acceptable. But again, it goes back to that personal recognition, which I think is inherently challenging because, like I said, the big book of Alcoholics Anonymous, it talks about addiction as cunning, baffling, and powerful. And to me, that says everything, because first you have to see it, and you don't want to see it because you enjoy it so much. And even when it causes pain, you still keep doing it because it does something for you. So it's complicated.
Thank you. So another question, curious about your emphasis on marijuana as addictive. Could you please comment on that?
I have people all the time who try to argue with me about marijuana not being a drug. And as a pharmacist, I typically win those arguments. But I will tell you that some people want to separate it out. And I will be the first to say that the medical use of marijuana has been incredible. And I think it has wider applications that we're probably underutilizing. But I will also remind